Hello, my name is Kathleen Wardell, and I am a University of San Francisco Masters of Public Health candidate in the Community Health Practice online cohort. And today I'm going to be addressing the increased prevalence of gestational diabetes among Hispanic and Latino pregnant persons in the Central Valley of California. First, I want to go over the objectives. I'll be talking about the public health topic and background, the research population I've chosen, the methods that I use to explore this literature review, the results of the research that I found, and following that, I'll go over the recommendations after going through all the culmination of literature reviews, and then how I can apply this to my community and the implications of this. So the research topic that I chose was gestational diabetes mellitus, and it's important that I first go over what is gestational diabetes mellitus. It's also called GDM. So GDM is a diagnosis of pregnant persons who have elevated blood sugar, who have elevated blood sugar called hyperglycemia that is found at the onset of pregnancy or first recognized in pregnancy. It can also be included with those that may have had pre-existing diabetes that is undiagnosed or pre-diabetes. And so they are also incorporated into this population. So from 2011 to 2019, the rate of gestational diabetes in the U.S. rose from 47.6 to 63.5 per 1,000 live births. GDM has also increased in the U.S. since the 1960s, where it was less than 1%, and now it's at 8.3% in 2021. So furthermore, I just wanted to kind of give a background of gestational diabetes, go over the risk factors, the maternal consequences, and the fetal consequences. So gestational diabetes is essentially diabetes in pregnancy, and there are certain risk factors that predispose pregnant persons to getting this chronic disease. First, ethnicity. Those that are of African American, Alaskan, Native American, Indian, Asian American, Hispanic and Latino, Native Hawaiian and Pacific Islander. These are all ethnicities that are most commonly, it's most prevalent in. However, I do want to emphasize that I do think there are some structural racism causes to the correlation of these ethnicities, and so shouldn't be ignored. In addition, there is a family history of diabetes predisposes those, and obesity as well. There are definitely a lot more factors, including one is highly processed foods in the Western diet, and inactivity. Those will certainly predispose one to this diagnosis. Some consequences for the pregnant person include they are going to have a lot of follow-ups, including checking their blood sugar, having to manage it with diet and exercise, and potentially medications. And they'll also be at risk to gestational hypertension, so high blood pressure. And then with that, if you have a child that is in a hyperglycemic state, these children tend to have to put their glucose somewhere, and so they have a lot of fat stores, and so these babies tend to get quite large. So with that, these babies are larger, which means a more challenging delivery, putting them at risk for a cesarean delivery or C-section. And when you have a large baby, there's at risk for injury of the mother, so perineal injuries. They can also be at risk to postpartum hemorrhage and therefore a prolonged hospitalization. And then on the fetal side, the babies tend to have short-term and long-term consequences. This is something that I see often as I am a registered nurse in the NICU, and this definitely doesn't cover all of the consequences and risk factors, but I'll go over a few. Short-term consequences include the babies are quite large, and so therefore there's a lot of things that put them at risk, including low blood sugars, When you have low blood sugars, it can affect the brain if it's prolonged. They can have a hard time breathing, so they'll have respiratory distress. They are at risk to just coming to the NICU because they're going to need a lot more assessments and checks. And they tend to have issues with initial delivery. They might have a hard time breathing. They have a hard time with their initial just resuscitation efforts. So we call that low APGAR score. And some long-term consequences include, because they're in this hyperglycemic state in utero, they have an increased deposition of adipose tissue, and so it predisposes them to being overweight and obesity, and they have a propensity to acquire type 1 or type 2 diabetes. Another interesting one is their increased risk of cancer. So why is this topic relevant and important? This is two pictures of babies that had gestational diabetes, and something that is near and dear to me. I see babies that look like this often. And so, I can say that these consequences are they're preventable. We can address this in the population. And so it's important that we mitigate these kinds of outcomes, and that parents see this and know what that looks like on that end, so that we can kind of give them a call to action to address controlling their gestational diabetes. And so another point to mention is that, the statistics showing increased prevalence, I'm seeing that as well as a bedside nurse. We're seeing more and more sicker babies with who are born from gestational diabetic mothers that are uncontrolled. And so it's very scary. A lot of times these kids will have undiagnosed heart defects that are very emergent and really severe respiratory distress at the point that they have to be transferred to a higher level of care and will have prolonged complications, including cardiac surgery. And so we want to address this. So this is my topic. So the research population I chose was gestational diabetes mellitus pregnant persons in Tulare County. I also chose the Hispanic Latino population, being that this is the majority of patients that I'm seeing with this condition. And it also reflects the race and ethnicity breakdown in Tulare County. If you see at the bottom right of this, or the bottom left of this slide, there is a breakdown of Hispanic population being 63.9%. So the majority of our population is made up of that ethnicity, and then the following ethnicities are of a smaller proportion to follow. The age group is between 14 and 55 years of age is what I chose, being that this is of childbearing age. And then those at risk to GDM, so elevated BMI, obesity, and prediabetes were part of the inclusion criteria. And so another important factors to address is that, Tulare County's community health assessment reported the prevalence of diabetes being 13.7%, as compared to the state average of 8.6. So certainly diabetes is a big problem here. And it also reflects what the community spoke to. In both the 2017 and 2023 community health assessment reports, the community responded in their focus groups, key informant interviews, and other surveys that diabetes was a top health concern in the county. And one of the follow-ups that was included in this assessment was that mothers were stating, there's a lack of access to healthy foods in rural communities, difficulty affording healthy food, and there's lack of education in managing of diabetes and medication. New moms, pregnant women that were participants, so there's a need for a better nutrition education during pregnancy. And one mother had stated in this spot right above here that she has 2 children. The other pregnancies were in Mexico, but in Mexico they had sent her to nutritionists and they checked her weight, told her what to eat, and she didn't get that in Tulare County. She also had 5 pregnancy workshops that worked on exercises, but she just didn't get that here. And so again, highlighting this need to address gestational diabetes and that preventative aspect so that we don't see it on the side that I see on the NICU where the damage has been done. And so the methods that I use to explore gestational diabetes, first, to organize the themes of my literature review, I use the social ecological model to address this chronic disease because of the challenging aspect, this complex disease. We need to address mitigating this outcome multiple layers. So addressing at a personal, social, organizational, community level, and policy level. Multiple databases were used, including PubMed, Google Scholar, SynHall, and also data from the California Department of Public Health and Tulare County Department of Public Health. There were 13 quantitative and qualitative research articles that I utilized to gather the information for this literature review. So the results of exploring this literature review of gestational diabetes, the main themes were that diet, exercise, of course, lifestyle interventions help mitigate gestational diabetes and should never not be included in our care. But we also are missing an important piece that I feel like needs to be incorporated in our care for all those with diabetes, but especially my population, gestational diabetes. So, and that includes an environmental health assessment. So many of the articles mention diet and exercise helping mitigate and improve outcomes, but we don't have any kind of, interventions related to exploring what exposures environmentally mothers have that could be, making it more challenging to address diabetes or obesity or even cardiac diseases, infertility as well. So there's an increasing need to address endocrine disrupting chemicals, and that's kind of the main theme of the environmental health exposure assessment. These endocrine disrupting chemicals actually can predispose people to obesity, diabetes, and infertility and cancer, and they mimic hormones that impact adipose tissue, and this can actually make it harder to address these chronic conditions. So if we can explore these exposures and eliminate them, we could be doing a big service to our community. So again, using the social ecological model, this is a picture from one of the research articles that kind of gives you an image of how we can address gestational diabetes at different levels. And so historically, we bring up diet and exercise at a personal level. However, it's way more complex than that. We need to have policy level interventions to eliminate endocrine disrupting chemicals. We need healthcare providers to be asking these hard questions about their environmental exposures. And so this is kind of a guidance that I'm using, and we'll explore at the next slide. So recommendations that I'm using with the social ecological model from all of the research that I've obtained to give just a few examples of how we can address gestational diabetes in a community, and specifically in my community that is really challenged by this chronic disease. First, from an interpersonal level, one way to address gestational diabetes is a self-management program with a diabetes educator and a telehealth support. So a lot of the research that I found was that when we had diabetes educators helping patients, and even with telehealth support, there was a large improvement in decreasing their gestational diabetes weight gain, decreasing risk of C-sections. And so this kind of intervention has been proven to be effective to help mitigate, adverse outcomes. From a social standpoint, if we could have our primary care providers as well as our OBGYNs, our pediatricians, all of our initial contacts in healthcare, take an environmental health assessment on our pregnant patients, find out what kind of exposures, they are being exposed to in the home or at their workplace, finding out that, hey, this chemical could be causing this issue or making it worse to lose weight. And so if we can take an assessment and then provide an opportunity for education, we can also be mitigating our GDM outcomes and potentially helping these patients. And so that is really important. From an organizational level, a lot of the research from our qualitative research, it showed that mothers were needing exercise classes for not only parents, babies, but parents and toddlers. And that there's a gap there in a lot of communities that these aren't available, and it makes it hard for them to get the exercise that they need, and also support system. Even peer support groups are also recommended. So all of these types of interventions can help really address this chronic disease. And this would also help decrease the fact that pregnant persons with GDM have a 10-fold increase in developing type 2 diabetes within the first 3 to 6 years after that GDM pregnancy. So if we can intervene with these classes, we're now really decreasing the rates of type 2 diabetes. From a community standpoint, many of the research articles emphasize the need for more green spaces and safe parks and recreation in our communities. And pregnant persons really needed this available to them. It's free. It's available for them at any time. They don't have to make it to a certain class. And so if we can do this at a community level, especially in our rural regions of Tulare County, it would improve exercise, improve mental health, and improve the community base. It also emphasized the need for active transport options, so improving our bike public infrastructure for people that want to get that kind of exercise. From a policy level, it was also mentioned that we could implement, we need to be implementing better regulation of these endocrine disrupting chemicals in the first place, because if we can eliminate these toxic chemicals that are making obesity worse, diabetes worse, then we're really hitting a preventative level and avoiding this conversation altogether. So those are different ways we can address gestational diabetes from a social ecological model. The implications. So again, addressing this chronic disease from a system solution approach where multiple stakeholders are invested at addressing diabetes will be the most impactful in the region that I live in Tulare County. I believe that through this research, I'll be able to have hands-on application to address some of these areas, and I certainly look forward to doing that because this is really passionate for me as a public health professional and as a nurse. And with that, that is it. Thank you all so much for listening to my PowerPoint presentation. Here are the references. Thank you.